For Action News, I'm Anna Dulosky. By the age of 2, 1 in 10 children is considered obese. That's a serious problem and it requires a serious solution. But now a new study claims it's found an association between the use of antibiotics in children under the age of 2 and an increased risk of obesity by the age of 5. Researchers looked at medical records of more than 64,000 children. The findings showed those who completed 4 or more courses of antibiotics had a 10% increased risk of obesity by the age of 5. But before you toss your child's medication, ACTIA's Dr. Gilbert Ross says, consider this. We do, in fact, have an obesity epidemic in this country, but it has very little to do with antibiotics.
They had no initial plan to find a cause and effect. They just did what we call a data dredging survey. They entered as many inputs as possible and they analyzed as many outputs as possible, and they found some link that reached a magical epidemiology mark of 95% likelihood that it's not due to chance. The only problem with that is that statistic applies if you're studying one input and analyzing for one output. In other words, a cause and effect. When you're analyzing 100 inputs and looking at 100 outcomes, the chances that you're going to find at least one so-called link is very high. So it's just a statistical quirk. It's a chance association. And to have something like this published in a reputable journal like JAMA Pediatrics, and to be, well, of course, the news media are going to seize upon it because it's a good headline. Say, many courses of antibiotics in infants may link to obesity. Where everybody these days, and for the last 10 years or so, is seeking some silver bullet as a cause of obesity. Anything that you can find that links something other than simple laziness and overeating to obesity is going to get a lot of media uptake. Some researchers and commentators have said, well, you know, they feed animals antibiotics every day for their lives in order to increase their growth. In other words, to get more pound for the buck when they're on the market. And we don't know exactly how antibiotics work to promote growth, but that's chronically fed. Every day these animals get relatively low doses of various antibiotics. That has nothing to do with an intensive course of antibiotics, even given four or more times to a baby, a human baby. It makes no sense. It's not analogous. And finally, the last nail in the coffin of this study, to say it's no news here at all, is so what? Let's say there was a cause and effect, which there isn't. What are you supposed to do now with a 1-year-old that's had a couple of strep infections or a strep infection and an ear infection, and then the baby comes in, the mother brings the baby in with a fever, etc. Do you not give that baby that third course of antibiotics because you're worried that when they're 5 they might be obese thanks to your antibiotic? No, of course not. Do not use antibiotics if they're not going to work, meaning a viral illness, etc. If there is a good reason to use antibiotics, by all means, use them. The chance of that causing obesity in a baby is remote and has nothing to do with this study. So there's really no news here, despite all of the news articles about it.
To read more on this story and others, you can head to our website, actia.org. And while you're there, don't forget to also sign up for your daily dose of news delivered straight to your inbox. For Action News, I'm Anna Dulosky.